right, wonderful. So I will go ahead and kick us off. So good morning once more, and thank you for being here for our webinar, Personal Attendant Care, What Does It Mean and Who Qualifies? Through this webinar, it's our hope that we educate our unique needs families across the nation on what's happening legislatively, what personal attendant care is, and who qualifies. We hope to build community and be a resource for those needing assistance. A little bit about myself. My name is Ariana. I'm the Marketing Communications Manager with Team Select, and I'll be monitoring today's event. Also, happy Caregivers Month to those who joined us today. So I will now introduce our two panelist speakers, Bill and Nicole. Some of you may recognize Bill from our previous webinars. He has been with Team Select for over 6 years and has a plethora of knowledge in the home health legislative space, working with lobbyists and members of Congress. Nicole has been with Team Select for over 8 years and who by trade is a nurse, but has always yearned for a larger platform to help families. Hi, Nicole. Nicole works closely with Bill on program development initiatives to help additional families across the nation. Join me in welcoming Bill and Nicole. Woo.
Thank you, Ariana, and welcome everyone. Similar to our previous webinars, I will kick us off with Family CNA or Certified Nursing Assistant Program updates. I appreciate the opportunity to update everyone on how Family CNA program evolves in several states and to give some updates on a federal level, both from CMS, which also stands for Centers for Medicare and Medicaid Services, and the legislative side as well. Team Select currently provides Family CNA program and PDN or private duty nursing services in 10 states and 36 locations. I've been in the home care industry for nearly 20 years now, spending most of my time as an administrator of PDN agencies. I've been with Team Select Family for over 6 years and have spent the last 5 years working on the Family CNA model to bring it to more families in more states nationwide. Many of you should all see the current slide up with the map of the United States. We're just going to talk a little bit about that slide now. Last time we went over the state of all the states on a slide. Today, I will update the states currently pending implementation for the Family CNA or Home Health Aid program on the slide. Please remember that each state may call an aid something different, from a LHA or licensed health aide in Arizona to a CNA, a certified nursing assistant in Colorado, to a complex care assistant in Massachusetts. Remember that these are all aids, so it's just potato depending on the state. Later in this webinar, I will give you an update on the states that will permanently allow parents of minor children to be paid caregivers as personal care assistants or attendants. We are separating these two models to make sure everyone understands the difference. For our current slide, the Family CNA program is mainly for those qualifying for private duty nursing. These individuals have mild to moderate acuity needs. The Family CNA program allows a family member, including a minor child's parent, to be their aide. Utilizing RN delegation of skill tasks or scope of practice for that discipline, these family members as aides can provide skill tasks to the client, like tube feedings, medications, etc. Delegation tasks and scope of practice vary by state. The following states have a fully active Family CNA program: Colorado, New Hampshire, Arizona, Pennsylvania, Indiana, California, and Massachusetts currently. We're going to talk about some legislation that has been approved and pending implementation for certain states. So Florida and New Jersey. Legislation in both states was approved this summer. We have been requesting a meeting with Medicaid, but neither Medicaid system has met with us to work on implementing this model for their state. We ask if you live in a state and would like us to assist us, please reach out to the Medicaid director of that state to express your opinion on why this program is needed as soon as possible. Please also request that they meet with organizations like Team Select for us to help them implement this program faster, as we have done in other states. In Montana, the legislation was approved this past May. The state is progressing towards implementing this model with help from providers and families. This model could start next spring, but it's moving in the right direction to be implemented sometime in next year in 2024. For Maine, legislation was approved this summer. Unfortunately, Maine is following Florida and New Jersey's example by unfortunately not meeting with providers and families to help with implementation. If you live in a state and would like us to assist, please reach out to the Medicaid director there in Maine to express why this program is needed as soon as possible. Please also request that they meet with Team Select for us to help them implement this program faster, again, as we have done in other states. Oregon approved by the legislation approved by the Oregon legislature this past June. This is a personal care program with a limited number of spots available. I know family groups are trying to increase the number of spots available for this new model, but are having some resistance from the legislature due to budgetary concerns. If you live in a state and would like to assist the family groups there, please reach out to your state representative, state senator, lieutenant governor, and governor to ask for the budget to be increased so all children who qualify for this model can receive the care they are entitled to as a resident of Oregon. And last but certainly not least is Washington State. Their legislation was approved this past May by the legislature and the governor. There they have a study to study the viability of this model, and those findings are due in by the end of this year to the legislature and the governor to be reviewed. Also, just a quick update as well, as many of you remember from our past webinar, we spoke about Massachusetts and their intention to file an amendment of their application to allow for this model under a PDN state plan. They were to be the first state to ever do so, and they found a way to allow for this to occur. CMS has actually approved their application, their amendment to their application, so it is now allowed for this model to work under a PDN state plan. So this opens up this option in many different states. And back to you, Ariana.
Wonderful. Thank you so much, Bill. And just kudos to you and Nicole for all the work you two are doing to help medically complex and medically fragile families through this program. I know it's a lot of lead work, but it truly means a lot to the families we get to help each and every day at Team Select. So we're now going to segue into a personal and attendant care update. After that, we will dive into the Q&A portion of today. I do want to note, like I did in the chat, that if at any time during the presentations from Bill and Nicole, you have questions, feel free to write them in the Q&A section. And if you're having difficulty with that, go ahead and stick it in the chat. We'll bounce between the two to make sure that your questions are heard today. And thank you for joining us once more. So I'll also take a moment to share their contact information like I did earlier, so that if you have any questions after today's call, you can either add them on LinkedIn or shoot them an email. So go ahead, take it away, Bill.
Thank you, Ariana. Next, we're going to review the slide regarding personal attendant care services. For this slide, we will discuss what states have elected to permanently allow the parents of minor children to provide personal or attendant care services to their children. As you can see, some states are applying for a new waiver for this model. Please check with your state to find out more information. This information that you see here today was compiled from the Kaiser Family Foundation. The only state that did not reply to the Kaiser Family Foundation with their survey was the state of Florida, so we do not have their information here currently. Personal care services are non-medical care. They're not prescribed by a doctor or clinically overseen by a home care agency. Home care agencies may provide support by managing HR or payroll duties for a case, but that is limited to their role under this model. In most states, this care model affects more individuals needing care than those usually needing a family CNA model. This model must be under an 1115 waiver or one of the HCBS or home and community-based services plans consisting of a 1915C, a 1915I, 1915J, or 1915K. That's the different HCBS plans to allow parents of minor children to be paid caregivers. It cannot live under a personal care state plan due to a direct prohibition under the 1905A of the Social Security Act, which that act states that a parent, a guardian, or spouse cannot be a paid caregiver for personal care services. The states that are allowing or in transition to allowing this model are the following: Arizona, California, Colorado, Connecticut, Delaware, Georgia, Idaho, Illinois, and Indiana, Iowa, Kansas, Kentucky, Louisiana, Maine, Maryland, Minnesota, Montana, Nevada, New Hampshire, New Mexico, North Carolina, North Dakota, Ohio, Oklahoma, Oregon, Rhode Island, South Carolina, South Dakota, Utah, Vermont, Virginia, and Wyoming. There are efforts by family groups to have the current prohibition reversed on the federal level. We, along with other providers and family groups, will continue working on getting this prohibition removed on the federal level. And back to you, Ariana.
Wonderful. Thank you, Bill. So I will give everyone just a few minutes to type some of their questions into the Q&A function. Now would be the time to use the restroom if you have to do so, or if you're at home, let the dog out. I know how that is. So I'll give everyone just a few moments here to type in their questions. And again, if the Q&A function is proving to be a little bit difficult, go ahead and stick it in the meeting chat and we'll make sure that your questions are heard. Yeah. Let's start with the question from Laura. I can answer that one, Laura. Yes, this presentation will be recorded. If you have any friends or family members who did register but aren't able to make it, they will also get that recording. So everyone who registered for today's event, which was a little bit over 220 folks, will get an email with the recorded version that will be posted on our company YouTube page. So yes, Laura. And thank you for joining. Thank you for taking time to join us today. So with that, we'll go ahead and kick it off to Andrea Bell. The question she wrote is she'd love to hear more details on what's happening in Maine. It's her understanding that stakeholders will be involved with the rulemaking as of January for a July 2024 start date. I'm sure you can read the rest. What do you have to say about that, Bill? And can you provide any additional context?
Sure, absolutely. So we've been engaged with the Home Care Association there in Maine, and I know they have been trying to work diligently in order to get communication on next steps with Maine Medicaid on implementing this model. So far, they have not received any comments back from the Medicaid system there in Maine. So any assistance you can give would definitely be great, but I know there's many providers that have been reaching out there to Maine Medicaid to try to get this started and going and being a part of the process. You know, I will tell you from working this in other states, when providers like ourselves and families are involved, a lot of the kinks are worked out, because one thing you have to remember with all these programs is states are allowed to do it differently in every state. So there might be some similarities in some states, but not every state is exactly the same. And so it helps when providers like us who work in multiple states can assist with some of the known challenges that we have faced in other states and give them ideas of what other states are doing currently right now to make the process go smoother. And families can also give their insight of what they feel will or will not work the best for their loved ones.
Wonderful. Thank you, Bill. Again, if anybody has any questions, feel free to type that into the Q&A or the chat. We did make sure to have some extra room for the Q&A today due to the interest we were seeing during our first webinar of a lot of questions coming in. So we want to make sure that your questions get heard. I see one from Jamie, Bill. She missed just the first few minutes. Thank you for joining us today, Jamie. Are there any updates for Washington State? And can you cover both family CNA and PCS or PAS really quickly?
Sure. So on personal care services, I'm limited in Washington State of my knowledge to just also due to the fact where it seems like currently it's not there in that state. I have limited knowledge there. What I would recommend is to, if you are involved in those services right now, to please contact your case manager there that's available through the state. In regards to the family CNA model, what is happening is the state, there was a lot of discussion trying to figure out how this model was going to be implemented, what tasks were going to be allowed under the skill portion for family members to be able to perform. And so the legislature, after hearing all this from all the stakeholders, from hospitals, home care providers, families, et cetera, and Medicaid, they decided to go ahead and conduct a study. And so that study is being done. They asked Medicaid to go and look at all these different ideas and to come up with what would be the most viable option and solution. And so that is due back into the governor and to the legislature by the end of the year from Medicaid. So that study should be made public, and then once it's made public, we'll get a better idea kind of where Medicaid would like this program to go, and then kind of take it from there in regards to legislation. And that more than likely it will have to have legislation in order to be implemented, but it is a step in the right direction.
Wonderful. Thank you, Bill. And Nicole, I have a question for you that we received from Laura. She wants to know who qualifies for long-term care in Arizona. I don't know if Nicole or Bill, you want to cover that one, but.
We can both tag team it. Long-term care in Arizona, I mean, it depends on if it's a adult or a child. But you would have to go through Access first in order to get long-term home health care or long-term care in general in Arizona. So Access is kind of the governing body, and then depending on the needs of either the adult or child, they would need to go through DDD for a second set of basic qualifications.
Wonderful. And she did say pediatric, so I do apologize for leaving that detail out.
That's okay. That's okay. Yeah, so they would have to start with Access, and then would have a separate set of applications and assessments and things to go through with DDD.
Wonderful. And she said they do have long-term care, but she means what family members? I don't know if she means age or relation, but maybe we could just lightly cover both.
Say that again, sorry.
She says they do have long-term care, but she means what family members?
I think
I don't know exactly.
Family members under the Arizona Licensed Health Aid. I think that's what she's asking, like who would qualify.
To be the provider?
Yes, ma'am.
Yes.
Yeah. So parents, mom or dad, are really the only ones that are able to qualify for the licensed health aid portion. With the attendant care side of things, I don't know. Bill, do you know that one? I know it's still mom or dad, but I don't know if they have it extended to like other relatives.
Correct. They have it to other relatives as well. Mom and dad are now allowed permanently, besides, because under as many of we know during the PHE, many states allow for parents to become paid caregivers. That typically was not allowed because most plans are personal care state plan. And so now that they're allowing that, it'll be parents as well as other family members that they, whoever the parents would like to be that personal care assistant. Just to let everyone know too, for the licensed health aid, Nicole is correct. There also are some others in Arizona. It is kind of strictly defined who is considered a family member. So their definitions of spouse, child or stepchild, son or daughter-in-law, grandchild, sibling or step-sibling, parent, step-parent, adopted parent, grandparent, mother or father-in-law, brother or sister-in-law, and legal guardian. That is their official definition.
Wonderful. Thank you both for providing some additional context for our guests today. We do have a question from Vicky. I will give to you, Bill, providing a bit more information about Montana. Again, I don't know if it's family CNA or PCS, so if you could provide both, that would be absolutely wonderful.
Sure. I don't have much information on the PCS side when it comes to Montana. And again, I would refer back to your case to a case manager there with Montana Medicaid. In regards to the Montana Medicaid family CNA program, which there they call the Pediatric Complex Care Assistant. That program is still in the process of being designed and implemented, but both the Board of Nursing and Medicaid are on it and working very hard with stakeholders to get this done as soon as possible. One of the things I will say is they are allowing their skill task. It's going to be a new scope of care, so there's not going to be any type of delegation. The Pediatric Complex Care Assistant will have their own scope under their license, under their being certified. And so they're going to be allowed to do skill tasks, basically everything there except for ventilator care. Including even like if you have a child that has TPN, which is a way to feed an individual. For those who are not familiar with TPN, a parent who is a pediatric complex care assistant would be able to do this. I know that not only agencies will be able to train individuals to become pediatric complex care assistants, but also facilities, hospitals will also be able to do that as well following this training. But again, it is still being developed, so there's only so much information we have so far based off of the legislation, and then everything else has to be promulgated through rules.
Wonderful. Thank you, Bill. And we have a question from Davina, my fellow Michigander. She's just saying, I'm in Michigan. We have not adopted this. What would be the next steps?
Sure. So no, that is a really great question. What I would tell you, the first step is, I would work on getting together other families who would like to have this program in your state first. Having strength in numbers. Legislators like seeing 20, 30 people on a call when you're discussing this. So first of all, doing that. Next is to reach out to the different stakeholders with the Medicaid director, reaching out to the governor's office, to individuals like us, to companies like us, to the Home Care Association, and getting their take on everything. And then from there, kind of figuring out what is needed in order to implement the program. It's more than likely probably needs a legislative change. And so with that being said, you will then need to work with the state legislature in order to get that change. So meeting with the leadership individuals, I'm talking like the Speaker of the State House, the Majority Leader, Senate President, Senate Majority Leader, etc., to meet with them to explain why this is needed and see if you can get sponsors. But if you'd like to reach out to me, I'm more than happy to discuss the process with you further and see if we can be of any assistance. We're not currently in Michigan right now. Team Select is not, but we're always willing to help families in other states that we're not currently in to try to help move this process along as quickly as possible.
Wonderful. Thank you for your wealth of knowledge, Bill, and you as well, Nicole. We have two questions from Mary, and I'm going to try to read the bottom one and then pop up to the secondary one. They're both in regards to Pennsylvania, Bill. So I know on our slideshow we mentioned that PA has the full version, but on our slideshow we mentioned that it was limited. She just wants to know information about that. Then she has a secondary question up top. I'll read: with staffing issues encountering in Pennsylvania in the area of CNA, HHA, home health aid, many of the parents were able to become paid caregivers during the pandemic. Within the last few months, as renewals are coming due, They're experiencing denials for some of the hours, and reasoning is these are expected parental responsibilities. Are the MCOs no longer covering certain hours? And how can the families and individuals in Pennsylvania best address these situations?
Well, let me start out. I'm going to start with the first part of it,
Yeah.
just to give a lay of the land, and then I'm going to have Nicole kind of talk about the authorizations and all that as well. So we'll tag team this. In regards to the program, so yes, she is totally correct. During the public health emergency, Pennsylvania Medicaid went ahead and allowed parents to be paid caregivers, especially as home health aides. Now, there was some question when the PHE, or public health emergency, was coming to an end here in May, this past May, if parents were home health aides, if that was personal care. And it's not. It's actually defined differently. So kind of personal care is here, then you have home health aide, and then you have nursing here is kind of the step ups. CMS sees it differently. It doesn't mean that a home health aide can't provide some personal care tasks, but most of the tasks that they're providing are usually a more higher acuity than personal care. So as long as the parent was going to be a home health aide, they were able to still be able to provide the service. We have been working with Pennsylvania Medicaid, and will continue to do so, because there needs to be a little bit more guidelines on how this program is set up. We found that when there's more official rules put into place, the program works better for not only providers, but also for the families and for Medicaid as well. And right now, there's not really a lot of guidelines, so we like to put a little bit more meat on the bone there with this model. Also, right now, Pennsylvania does not allow for the delegation of skilled tasks. So there are other options for us to be able to allow parents to be paid for those skilled tasks, and that we're exploring right now in Pennsylvania. So there's more to come. It'll probably have to be through a legislative initiative, but there's more things that we're working on when it comes to Pennsylvania. Nicole, I'll turn it over to you in regards to more about reimbursement authorization.
Yeah, so like Bill said, we've been working with like the Board of Nursing in Pennsylvania with the PHE ending. A lot of families were experiencing that appeal of like, well, this is ending. There was kind of a huge uproar. Families got together and they did end up making that a permanent program. But I think a lot of times the telephone game, the Board of Nursing is trying to relay to however many different MCOs are in Pennsylvania, all of that information, when the information they had was that this isn't going to be permanent. So I think that there's still a lot of that still happening to this day of families that are going through that. Well, it's not a permanent program. Bill, did Sally ever send any permanent, like, do we have that we could maybe send to Mary that she could start with her case manager at the MCO? Okay.
Yes, no, that's a great point. Yes, there was actually a memo that was sent out to the MCOs, the managed care organizations, from Medicaid, and so we can go ahead and make sure that is. I'll look in the chat here. I actually have the attachment I'm looking at right now. I just don't have the links.
So Mary, I would we can send you that the verbiage and what was supposed to be trickled down to the MCOs, but always starting with an appeal, escalating from the case manager that told you that you were denied, escalating to their boss, and so forth, and starting maybe like a formal appeal process if they're still denying those hours would be definitely where I would start.
Wonderful. Thank you both greatly. We have a question from Jackie. Can we provide an average startup cost for states that have adopted this program so far? And what's the reasonable fiscal note for establishing a parent training program like this?
Sure. So from a state standpoint, typically under the family CNA model, usually there's the state will see a cost savings due to the fact that typically we are reimbursed at a little bit lower rate than what a nurse is paid for this model. The other aspect of this too is the cost savings regards to hospitalizations. Hospitalizations go down dramatically with this model. So, if you look at hospitalization at, $4,250 on average throughout this country, and it's more in other portions, and like in LA, it can be up to $15,000 a day. It's a huge cost savings for the state. So from that aspect, there is a lot of cost savings. From the actual setup side, of course, there is time from working with the legislature to also implementing. What we try to do with states is to work with them, because we've been down this path many times before, to give them kind of more of a roadmap, so we can help them to move this along and then make it as easy as possible. But it's more internal on an internal side of promulgating rules and things like that. So I would say probably what you would normally see when promulgating new rules for a program. But how we try to do it is to create this under our current benefit and not having to create a whole new waiver or system like that. So that also keeps the cost down by working within the means you already have currently. On a personal care side, there will be greater utilization because parents will be able to actually get the staff they needed to staff their case. So there is greater utilization, but at the same time, with that being said, you will see the need for hospitalizations and the need for individuals staying in facilities decrease, because cases are able to get staffed appropriately quicker. And Ariana, I would like to add just back to the Pennsylvania. I did find the actual memo. I have the link here. Did you just want me to put it in the chat or on our Q&A?
Yeah, feel free to put it in the chat, Bill. That sounds great.
Okay.
So we have two Q&As from Andrea, and I just want to say, Andrea, with the first question, you have a lot of questions and you would love to connect with someone on the parent caregiver aspect of it. I'll work with Bill and Nicole after this call to make sure that we provide you with some potential resources for the variety of questions. But then I saw you asked something above here, which I'll scroll up. And Andrea wants to know, regarding the parent training, is there a means of expediting or customizing the CNA training process for parents who have been caring for their child for years? A CNA in her community suggested that it might be possible for them to test out of tasks that are routine in our child's care.
So that is a good question. So currently the only state right now, which again, you've got to remember there's 4 other states that are in the process of implementing this model. Currently, Massachusetts is the only state that allows for testing out of any of the training during the agency training for a CCA or a complex care assistant. I know some other states are looking at this because this has come up before. The one thing I always talk to states about is, we're not training parents on skill. You obviously already know how to do the skills, and let's just be honest, sometimes you teach the nurses that are out there how to perform the skills. It's really what we're teaching is why we do what we do. So as Nicole hears and I hear, and in Colorado from our Colorado families, we know when to freak out, not to freak out. And so it's understanding and become more of an informed consumer of all the things that we do on our end from a medical side. So yes, there is a state that does allow that. Do I think there's going to be more states that may allow for testing out? Yes. I know that's being considered by some states. So again, just depending on what state you're in and what is their comfort level with allowing it. It's just, it's just how that's going to be with allowing it. Now in Massachusetts, I will say that it is up to the agency. They put the onus on the agency, so just depends on the agency, which in my view, it should be just our comfort level of do we feel the family can test out of this particular training, if that's the skills portion or if that's the more of the kind of book work, whatever.
Wonderful. Thank you for that insight, Bill. There's 2 questions from Christine, and I want to ask you, Bill, if you have a second to go into the Q&A and read it, because I feel like I'm not going to relay that information correctly. She wants to know what the NR means in Florida and make sure that she understands some things correctly with Medicaid and Medicare. There is a comment from her below about what she means. No adult child of a Medicare enrollee can receive personal care reimbursement. I'm going to give you a second just to read it over because I know it took me a second, and ask if you have some insight, or Nicole, to share about this.
Sure, absolutely. So that
I responded to it in the chat, Ari, but I think I know what she means is if an adult is trying to care for their parent and they're a Medicare recipient, if there's any kind of programs or anything like that, which I think is what she was asking. So I had just said that, yes, these type of programs are only for Medicaid recipients. They can be dual eligibles. When they get older, they can be Medicare and Medicaid, but unfortunately, Medicare does not pay for long-term care much past a couple CERT periods, which are usually 60 or 90 days. So unfortunately, they have to be on some type of long-term Medicaid program in order for these programs to be accessed.
Wonderful. Thank you, Nicole. I genuinely appreciate that. We do have a question from Jackie. 2 questions here. Where can she access cost savings and financial data? And then she did just put a new question in there about if we have proprietary ready-made training programs available to states, sort of like a Relias. And if states adopt this, do they need to create the training modules from scratch?
No, that's a great question. Before I get back to, I just want to just piggyback on what Nicole was just saying. The NR that she was asking about it is not available at this time. So again, that list that you saw was actually compiled by the Kaiser Family Foundation, and when they had reached out to Florida, they just never heard back. So that's why there's the NR. So I would definitely reach out to Medicaid there for questions, or also your Medicaid MCO there in the state. In regard to Jackie, you were asking about the training. So it's not proprietary training. So the training is based off of what the state allows and calls for. So for example, when you look at a state like Colorado, it's the CNA training. It's the same CNA training that a CNA would get if they worked in a facility. When you have the training in Massachusetts, it's based off of a home health aide training. So the home health training is based off of CMS's guidelines to train a home health aide, which CMS's guidelines is 75 hours of training. 16 of those hours must be hands-on or clinical training. The rest can be done through text work, classroom training. And then an additional 10 hours that is done going over the skills that are going to be delegated to that individual in Massachusetts. Like Pennsylvania and Indiana, they use just the CMS home health aide training. So to do that, a agency, for example, can go out and acquire that training from a reputable educational institution, and they then from there can use that training to train individuals as home health aides. So it's pretty easy to do. It's something that we do. So do that in many of our offices. Arizona's a little different, where the training here is approved by the Board of Nursing, but every agency can do a different version of training. as long as it's approved by the Board of Nursing. So the only issue with Arizona is that our training would be different than one of our competitors because it can be, it can be different. So there's no standardized training as there is in other states.
Wonderful. Thank you. We do have a question from Alessandra in the chat of today. She's unable to access the Q&A, but her question is, what exactly is North Carolina doing? As families, they're getting conflicting information from Medicaid of what is permissible under their waiver and state plan policies.
Sure. So under the, I do understand when you talk about North Carolina, because I've read the regs many, many times, and it can be very challenging to understand that. And there's a lot of complexities when it comes to the different type of aids and the different things that they're allowed and not allowed to do. North Carolina is a state that we have been working on to try to get more clarity there in regards, especially to the family CNA model. There is a lot of evidence to show with the current regulations that this model could be allowed. Currently, it's just making sure that Medicaid would reimburse for it. So, and that's not uncommon in some of our states to see that. We have some other states that are like that, where there's really nothing precluding an agency from doing it. It's just making sure that if the agency does go and do this, we're going to be reimbursed for it. So we are continuing to work on North Carolina. If you would like to reach out to me to talk further, I'm more than happy to. I actually are working with some other agencies and the association there, and I'm one family member already. So please feel free to reach out to me and we can discuss further.
Wonderful. Thank you, Bill. To both Bill and Nicole, they have some California questions from Jenny come in. So California has an IHSS/WPCS programs that allow parents to be paid for care. Is the California CNA program supposed to be used instead of IHSS or in addition to IHSS? She also asks, how does this work with the California home health aid scope of practice? And can she just get more information on the CNA program in general, which I know I have the answer to number 3, but Nicole or Bill, will you kick us off with 1 and 2 here?
Sure. I'll go ahead and kick it out and kick it off, and Nicole, please fill in anything if I miss anything here. But it's under the HCBA waiver. So home and community based alternatives waiver, I believe. And I'm sorry, I try to keep all the acronyms, remembering everybody, but sometimes a little hard to do. But it's under the HCBA waiver there in California, which is through the regional centers. The challenge in California is there is delegation and it's allowed, but it's a very, very, very narrow scope to the point of really not allowing for anything. So that is one of the challenges with when we discuss the family CNA program there. That's one of the challenges with it that we're been trying to work on. In regard to allowing both IHSS and the HCBA waiver, I am not sure. I would assume that you would have to probably more than likely have one or the other, but Nicole, do you know at all?
You can have both.
Okay.
Yeah, the IHSS program in California is it's interesting. Most things in California are interesting. They run their IHSS program through the regional centers. So there's no middleman. It's basically just a very, very, I don't even know if it's minimum wage worthy, but a very low rate for IHSS for a certain amount of hours for, submitting some paperwork and things like that you're doing. It's a very limited program, but it is run through the regional center. There has been success with doing CHHA in conjunction with IHSS because they are kind of separate and don't really speak to each other a little bit. And then as far as in general, the CNA program, California has made that educational program extremely extensive. There hasn't been a ton of success around people doing this in California because of the length of time that the state is expecting people to go through. So when you're a parent of caring for your kiddo, trying to find that time to do all of the hours and all of the clinical hours that are required in California has become quite difficult for families to get through. Not saying that it can't be done, it is possible. It just adds an extra layer of strain and stress to get through that.
Wonderful. Thank you both. We're going to finish with one last question for today from Andrea in Maine. So in Maine, the only way to get paid family caregiver program covered by Medicaid was to go through Section 40. Section 96 is the PDN nursing agencies that currently work with our child. Can you speak to coordination between sections of Medicaid that is happening in any other states? PDN agencies are familiar with our kiddos and hold the care plans currently. She's hoping that there is a good way to streamline, i.e. not need to duplicate admin, supervision, and care plan responsibilities.
No, that's a really great question. So when I was talking earlier about like the PDN state plans, trying to make sure that we can do this program already under the current benefit, streamlining it, making it easier. So we're not going to another bucket that we have to work through. Is not only easier for the families, it's easier for us, and it's also easier, honestly, for Medicaid to deal with as well. And so that is the biggest thing, is making sure, yes, that we can have this under a benefit where, especially if that's already where the benefit lies for PDN, that's right under it. So that way it's easier to understand and easier for the families to be able to access. So that is the goal. And that's one of the things that we try to work on with states, to give them the different options of, hey, you could potentially do this under a state plan. And some states it works better because of how their licensure set up is to do it under home health. Sometimes I have states, I have one today that I'll be talking to, that they want to look at another state and say, hey, I want to do it like this state is put the legislation through. And I have to explain that they can't, because that's not where their benefit lies. And it would create some licensing difficulties for the agencies already doing it. We want to make sure that there's access to care. So meaning that the agencies that are already providing this care can still provide this new model, and making sure that it's under their current license. So yes, those things are very important, and that's why it's also key that stakeholders like us are involved in those conversations, to just let the Medicaid agency know of the different benefits, and then also the other potential issues and how to avoid those potential issues. So that way the model is rolled out as smoothly as possible.
Wonderful. Thank you, Bill, and thank you, Nicole, for the wealth of knowledge that you're sharing with us today on today's webinar. So if there aren't any more questions for today's webinar, we'll go ahead and close this informational session out with a huge thank you for tuning in today. Whether you're with a hospital, a nonprofit, a foundation, state legislators, agencies nationwide, whether you're a parent caregiver, we genuinely appreciate you coming together with us today, listening to these two amazing speakers, asking the right questions, and allowing us to help you. Just know that Team Select is always here to help you, whether you're a parent or a foundation or anyone that I mentioned earlier along your journey. So don't forget to follow us on all platforms and share our message. Like I mentioned in the chat earlier, we will be sending a recap email for everyone who registered for today. with the YouTube link to today's recording. So Bill and Nicole, would you like to close this webinar out with any final words for our guests today?
Yes, I just want to thank everyone and thank you, Ariana, and thank you, Nicole, for joining me today and all your work in helping getting this set up. Really greatly appreciate it. I also want to just wish everyone happy Caregiver Month. November is Caregiver Month, so thank you for everything that you do. I really do really appreciate and admire it. And also as well, if you have any questions, please feel free to reach out to me. If I don't know the answer, I will get you to the right person or get you directed to that individual. And Nicole?
Yeah, I mean, everything that Bill said, I just want to thank everyone for being on here. There's a lot of tireless work going on out there, and it's great to see people coming together and advocating together because it's the biggest voice out there, right? I mean, Bill can do as much as he can from his side, but the families coming together truly has the loudest and most impactful voice vote. So I just want to thank everyone for being a part of this.
Absolutely. Thank you, Nicole and Bill, and thank you, everybody. And we wish everyone a wonderful holiday season ahead, okay? Hope you guys have a wonderful rest of your week, and we'll see you all soon at our next webinar.
Thanks, guys.
Thank you.
Thank you.